would you like to say a few words?
Is muted.
Oh, but
Sudhir
we
Shah
can
is
hear.
muted.
Hello, good evening, everybody, and most welcome to IAM Contemplative Neurology Subsection. Thank you for attending this wonderful conceptual conference webinar. And this today's topic is neuroscience of spirituality. As you all know, this subsection has been started only a couple of years back, and our intention is to cover all non-clinical things, non-academic things, so to say, in this realm. So maybe all humanities, including art, music, literature, spirituality, culture, dance, and everything which we don't discuss in our classrooms, textbooks, journals, lectures, and conferences. And these are fortunately most integral part of our daily life and our culture and our humanities. So we thought to expose all our Indian neurologists and those who are even abroad with these beautiful, wonderful topics. And today we have selected neuroscience of spirituality, and the doyen of psychology and psychiatry, who has done phenomenal work on neuropsychopharmacology and circuitry of brain and all that. Dr. E. Mohandas, no, none else than him himself, has agreed to deliver this wonderful talk. And I'm personally obliged that because of our long association, he has agreed. Thank you, Dr. Mohandas. And I request that all of you please have a nice listening to what he said. And Dr. Vasudevan, your request please to introduce the subject and the speaker both. Thank you very much. Thank you so much. Welcome.
Thank you, Dr. Sudhir for that nice introduction. We are having this program after a considerable gap because we were actually looking for good topics and then even more important, a better speaker, which we have today. And it is indeed my pleasure to introduce Dr. E. Mohandas, who is currently consultant psychiatrist at the Sun Medical and Research Center, Trichy in Kerala. He is director and professor of the International Institute of Organizational Psychological Medicine. He is a council member of the International College of Neuropsychopharmacology. And previously, he was the zonal representative at the World Psychiatry Association and was also the chair of the WPA section on psychiatry in developing countries. He was the chair of the Indian Association of Biological Psychiatry and the president of the Indian Psychiatric Society, and also the president of the Indian Association of Private Psychiatrists and Society for Bipolar Disorders in India. He is been a prolific writer as well, apart from being an excellent speaker. He has been the editor of the Indian Journal of Psychological Medicine and Psychiatry Management Update, and also the editor of the Kerala Journal of Psychiatry. He has more than 100 publications to his credit. He has won more than 40 awards and he has edited 5 books. And today's topic is equally interesting. And I welcome you, Dr. Mohandas, to deliver your talk on the neuroscience of spirituality. Dr. Mohandas, please.
Thank you very much. Can you hear me?
Yes, sir.
Yes, sir, we can hear
Yeah.
you.
Yeah. Dear Dr. Sudhir Shah and Dr. Vasudevan, it's a pleasure to address the neurologists of India. The first time I addressed was in Madurai, so many years back. And then Ahmedabad, I think, with Sudhir Shah. Anyway, this was an opportunity, so I thought that I will share whatever I know about this neuroscience of spirituality. And you can add or delete whatever you want.
ॐ भूर्भुवस्सुः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात्.
Now, we want to know what is spirituality. Spirituality, the word has come from spiritualitas, meaning breath. That means individuals' personal experience, attaining positive emotions. What are the positive emotions? Love, hope, joy, forgiveness, compassion, trust, gratitude, and awe, which provide a great sense of inner peace and harmony. That is what spirituality means. Christina Puchalski has put another way of definition: the way individuals seek and express meaning and purpose, but most important, they experience their connectedness to the moment, to self, to others, to nature, and to the significant or the sacred. Anyway, it is the connectedness. So, spirituality means it is quest for meaning and purpose, transcendence, connectedness, and you're embracing the values. The components of spirituality include trust, compassion, love, hope, forgiveness, joy, and gratitude. The spiritual practices people do are they include prayers, meditation, yoga, especially yoga meditation, chanting, religious worship, and other rituals. What are the spiritual experiences? Feeling of transcendence, tranquility or quietude, sense of joy and pleasure, feeling of detachment and feeling of union with God, feeling of detachment or feeling that is called your Anandamaya Kosha, and visual experiences, analgesia, and sometimes mystical and trance states. What is the difference between spirituality and religiosity? You can be spiritual but not religious. Even you can have spirituality without religion. Religion means only religare, to bind together. That means it is an organized sector where some people share the same system of beliefs and practices. The religious involvement or religiosity is another term which is employed, that is the degree of participation in or adherence to the beliefs and practices of an organized religion. What the research shows, majority believes in a spiritual life. Patients would like to address their spiritual needs. Religious involvement and spirituality may result better health outcomes. However, the research does not show if the religious or spiritual people do not get sick. That is not true. You can get sick. Illness is due to lack of religious faith or spiritual effort. Absolute nonsense. Spirituality is the most important health factor? No. It is an additive factor or adjuvant factor. The reality is it's a source of comfort versus source of conflict for many people. Also, it's a source of meaning and stability for many versus institutionalized irrationality. How come institutional irrationality becomes? The reason is all God men are not good men. That is the reason. Many people may not be good. The meditative practices, the most important one is yogic meditation. Yoga is derived from the Sanskrit word yuj, which means to attach or yoke onto. It is the union between body, mind, and spirit. Yoga has got many components: the ethical values, moral duty, self-discipline, postures and asanas, the breath regulation, pranayama, but most important, meditation. That is pratyahara, dharana, dhyana, and samadhi. In pratyahara, that's a sensory withdrawal, minimizing sensory input and relaxation exercises. In dharana or concentration, single pointed, effortful, focused attention, basically object based. Dhyana, that is effortless meditation, unbroken flow of attention, open monitoring, object based or not. The last one is the integration or samadhi, that is transcendental or self realization. There are many meditative techniques. Focus attention may be internal or external. Example is Zen meditation, mantra visualization, body part, candle, mala beads, or sound. Samatha meditation is mindful breathing. Mindfulness meditation is purposefully bringing one's attention to experiences occurring in the present moment without judgment. Example, Vipassana, and even some of the Tibetan meditation techniques. Tibetan, there are many types. There is open awareness meditation. It's to create a state that promotes divergent thinking, which helps with the generation of new ideas, but basically focus on the cultivation of metta awareness. That is before Anandamaya Kosha. Non-dual meditation practices, these are basically described in Vedic, Hindu, Buddhist, Tibetan Buddhist tradition, especially the Theravada Buddhism. It is to achieve experiential insight into the true nature of consciousness and to connect with a more unified reality underlying our daily experience. You are completely detached from your usual life. Loving kindness and compassion meditation, it is a technique which is described as a therapeutic technique. Now, what automatic self-transcendence meditation? This is turning one's attention inwards towards subtle level. So thought becomes completely still, at rest, yet fully aware. In Christianity, it is called Unio Mystica. Islam, it is called Bhakwa, selfless pure consciousness. Hinduism, Samadhi, that's full contemplative awareness. Buddhism, Bodhi or enlightenment. Now, systematic reviews, especially more than 25 RCTs, effect of yoga and sympathetic and parasympathetic system. It has got a better control, better regulation of sympathetic nervous system in HPA, and it has been suggested that it can decrease depressive and anxious symptoms in some population. The yoga usually provides experience-induced neuroplasticity, increased telomerase activity in peripheral blood mononuclear cells, meaning it can have better longevity, increase oxytocin levels, enhance GABA tone, enhance release resilience due to antioxidants and neuroimmune modulation, and better health adjuvant in psychological or psychiatric states. Mindful meditation, there's activation of anterior cingulate, ventromedial prefrontal cortex, and anterior insula. For example, self-awareness, controlled by insula, medial prefrontal cortex, posterior cingulate, and precuneus. I hope all of you know all these areas. Attention control, anterior cingulate and striatum. Emotion regulation, multiple prefrontal regions, limbic regions, and striatum. I don't go into details because my favorite area is functional neuroanatomy. Many of the people would have attended my webinars. Also, many RCTs have suggested that these yoga practice can decrease the pro-inflammatory transcription factor, so better immunity. And also you have better relaxation, elevated alpha and theta oscillation, state of relaxed alertness, which is conducive to mental health. This I will skip. Beneficial effects have been recorded in depression, anxiety, suicide, substance abuse, coping with illness, health-related quality of life. Possible mediators include health promoting behavior, strong social support system, positive emotions to decrease activation of autonomic nervous system. They say most of the meditation will really decrease the parasympathetic drive, then it will produce a balance, enhance immune function, and other mechanisms. In Hindu philosophy, Purusharthas, Dharma, Artha, Kama, and Moksha, you can say the great epic Mahabharata identifies supreme Dharma with compassion, forgiveness, and gratitude, which are components of spirituality. Spiritual neuroscience is otherwise called neurotheology, focusing on the neurological processes underlying spirituality, faith, mysticism, meditation, religiosity, and beliefs. This is the gentleman who has written the book Neurotheology. Now, what are the positive emotions of spirituality and how to correlate? Love is one of the major components. Basically, the areas involved are ventral tegmental area, nucleus accumbens, amygdala, hippocampus, anterior cingulate. Here is the anterior cingulate, hypothalamus, and prefrontal cortex. Forgiveness is another positive emotion. Left superior frontal gyrus, left or right precuneus, posterior cingulate, and right orbitofrontal cortex. Empathy is another positive emotion. It is affective sharing between self and others. The areas involved are anterior insula, you can see the picture, superior temporal sulcus, amygdala. Superior temporal sulcus, you know pretty well, where the mirror neurons are implicated. You can read from the Google mirror neuron system. Some years back, I have written on it. You can get, I think, free. You can read it freely. Anterior cingulated areas of premotor cortex. Adopting the perspective of others, basically the frontal pole and inferior parietal lobule. Self-agency and emotional regulation, multiple areas are involved. Ventromedial prefrontal cortex and precuneus and temporoparietal junction and posterior cingulate. In compassion, in contrast to empathy, more areas are recruited, especially the ventral pallidum, globus pallidus, externa, putamen, not only interna but externa, and subgenuine anterior cingulate, etc. Morality and trust, prefrontal cortex mainly, anterior temporal lobe, amygdala, basal forebrain, ventral tegmental area, and ventromedial hypothalamus. Trust, positive decision to trust, head of the caudate and caudate and anterior paracingulate. And negative decision to distrust, that means you have to have take contemplation whether it is right or wrong. There, your prefrontal cortex is more involved. Gratitude, the great ratings of gratitude would correlate with the brain activity and circuits associated with the moral cognition, that is medial prefrontal cortex and anterior cingulate. Reward, especially pleasure of receiving benefit, ventromedial prefrontal cortex, and with the social cognitive processes, the areas involved, especially dorsal medial prefrontal cortex and basic emotion, that is insula. Happiness or joy, life itself is a tragicomedy. It is maybe an ocean of miseries with islands of happiness and joy, or it can be an ocean of happiness with islands of miseries. The major hotspots for pleasure are rostro-dorsal part of the medial cell in nucleus accumbens and posterior ventral pallida. Putativa, mid-orbitofrontal cortex, insular cortex, and parabrachial nucleus of dorsal pods. So, in spiritual experience, there is a differential activity in temporal lobes, cingulate gyrus, superior parietal cortex, precuneus, anterior cingulate cortex, insula, and prefrontal cortex. There's a frontoparietal activation and frontolimbic affective system activation. Systemic reviews have reported, especially with spirituality or religious experience, with EEG, MRI, fMRI, and PET. Areas involved are medial prefrontal cortex. You can see from here, medial prefrontal cortex, orbital frontal cortex. You can see the precuneus here, posterior cingulate, and default mode network and caudate. 8 brain regions consistently altered in meditators. One is the frontopolar cortex or area, Broadband's area 10. That is for beta awareness and metacognitive capacity. Many sensory cortices and insula, they are involved. For example, activation of insula, interoceptive awareness, empathy, and metacognition. And pre-supplementary motor area, area 6, you can have ventral anterior cingulate, area 24, where from the anterior cingulate circuit originates. So, and complex mental tasks, working memory, attentional control, imagery, and conceptual reasoning, these are all correlated. Hippocampus, memory consolidation, reconsolidation. Amygdala, feelings of profound joy, calm, and intense awe. Activation of the brain areas in meditation practice, anterior cingulate and mid cingulate. Some people don't say mid cingulate. And orbitofrontal functions and emotional regulation. Corpus callosum also involved because of the intra and interhemispheric communication. Superior longitudinal fasciculus because it is a massive direct bidirectional information highway that is crucial for language, attention, and executive function. Now, very recently, periaqueductal gray has been implicated in spirituality because of its most connectivity. Only 2 regions afferent to the periaqueductal gray without reciprocal connection is only orbitofrontal cortex and insula. All other areas have got reciprocal connection with the periaqueductal gray. Since last 2-3 years, this is, being talked about. Default mode network is basically posterior cingulate and medial prefrontal sulcus that becomes active, so your wandering mind, etc., you know that. In earlier studies have documented a number of people with religious or spiritual experience, very difficult to get it. They were asked to recite the first verse of biblical Psalm 23. There was activation of right dorsolateral prefrontal cortex, dorsomedial frontal cortex, and right precuneus. So there is a circuit which really involves dorsolateral, dorsomedial prefrontal cortex, and medial parietal cortex. This is the first article which has come. Then cerebral flow during verbal-based meditation by Franciscan nuns, SPECT study, there was increased blood flow in prefrontal cortex and inferior parietal lobes and inferior frontal lobes. This is often quoted by Lasser and others. Lasser is a female. Brain region associated with attention interoception and sensory processing were thicker in long-term meditators. That means experience-induced brain plasticity, especially insula, Broadband area 9 and 10, somatosensory cortex, and auditory cortex. Mystical experience in Carmelite nuns, activation in the right medial-orbital frontal cortex, the right middle temporal cortex, and even left side also, and activation of extra straight visual cortex, especially when you are having a open-eyed meditation. Now we will come to the class of what happens in meditation. There's activation of prefrontal cortex, especially right hemisphere, activation of amygdala, and right thalamic reticular nucleus activation. That in thalamus, only thalamic reticular nucleus is GABAergic. All other thalamic nuclei are glutamatergic. So when there's a GABAergic increase, it goes to the right superior parietal lobule. It will have a GABAergic effect, that means a benzodiazepine effect, and then right amygdala and right ventromedial hypothalamus. Ventromedial hypothalamus, what happens? There is an inhibition of the paragigantonucleus and locus coeruleus activations dull down. What happens then? It produces relaxation, quiescence, reduction in heart rate and respiratory rate. That means there is a parasympathetic hyperactivity. Reticular nucleus activation, it stimulates posterior superior parietal lobe, increase GABAergic effect, so can be used for anxiolytic effect. Prefrontal cortex activation increases glutamate. Glutamate stimulates release of beta endorphin from the arcuate nucleus of the medial hypothalamus. And that reduces fear, pain, and sense of joy and euphoria. A drop in blood pressure relaxes arterial baroreceptors. Decreased GABAergic inhibition of supraoptic nucleus of hypothalamus can produce release of arginine vasopressin. That produces positive effect, reduce fatigue, improve consolidation of new memories. You can get from the reference Newberg and Iverson or Mohandas and Rajmohan. From the Google, you can get it. So neurochemical changes increase arginine vasopressin, increase GABA, increase melatonin, increase serotonin, and decrease cortisol and norepinephrine. Less norepinephrine to paraventricular nucleus, decrease CRS, and decrease cortisol. Left, instead of right, now come to the left posterior superior parietal lobule, to left hippocampus, left amygdala, the lateral hypothalamus, the innervation to dorsal raphe, and the pineal gland, and goes to a sympathetic system. Now you have to have a balance between parasympathetic and sympathetic. Lateral hypothalamic stimulation results in alteration in serotonergic activity. Increased serotonin produces a positive effect, not very much increase, but slight increase. Analgesia, some meditative people with spiritual experience analgesia. Increased serotonin combined with the lateral hypothalamus innervation of the pineal gland. There's increased production of melatonin, produces calmness and decreased pain sensitivity. So anxiolytic effect is basically because of increased parasympathetic activity, decreased locus coeruleus firing, and decreased CRH, endorphin release, AVP release, and increased GABA. Antidepressant effect is because of the increased 5-HT, increased dopamine, increased arginine vasopressin, increased melatonin, increased BDNF, brain-derived neurotrophic factor, and beta-endorphin release. That produces NMDA receptor antagonism, which is the usual crux in all antidepressant mechanism, and decrease CRH and cortisol in depression. Cortisol is increased, that you know all these things. But in some people, they will have a mystical state. The heightened activation produces 5-methoxy dimethyltryptamine, DMT, that produces outer body experience, time and space distortion, and mystical state. But some people develop psychotic states. I usually call spiritual psychosis, is basically because of the activated cortical 5-HT2 receptors. You know, serotonin has got many family of receptors, not the 7 family, more than that. I will not go into details. The cortical 5-HT2 receptor stimulation can produce visual hallucinations, and it can produce increased 5-methoxy dimethyltryptamine DMT, increase N-acetyl aspartate glutamate or NAG, and increased dopamine. Cortical 5-HT activation can produce hallucination, mainly visual. 5-HT inhibits lateral genucleate nucleus, reduce information, visual information transfer that can produce more images. Reticular inhibition of lateral genucleate nucleus also. I think N-acetylated alpha-linked acidic dipeptidase hydrolyzes N-acetyl aspartyl glutamate or NAG to glutamate. Under hydrolyzing condition, when naldase is active, NAG had toxic effects. The NAG really produces psychotic effects. Inhibiting naldase would decrease glutamate and increase NAG. NAG's toxic effects presumably is due to liberation of glutamate. It is a glutamatergic toxicity data. NAG is a beta-tropic glutamate receptor agonist and N-methyl D-aspartate is a partial agonist that is neuroprotective. I will not go into glutamate receptor system. Given time later, we will see. Learning makes men more stupid and foolish. This is thing. I think I have stopped in time. Thank you. Are you there?
Yes. We are very much
Yeah.
here.
So I have finished in time now.
Yes. Is that, have you finished, sir?
Yeah, I have finished. Thanks. I have put
Okay.
it last.
Yeah, because the last part was not audible, so there was a bit of a glitch there. Yes. Thank you very much, sir, for that.
You want to hear again?
Yeah, the last slide, please.
Oh,
The last
okay.
slide.
Okay. I will
Last
do
and the
that.
second last.
Okay, I will do that. The reason for psychotic states,
Yeah.
it is basically because of the NAG that is called N-acetyl aspartate glutamate, which I have told. It has got toxic effects. Now, inhibiting naldase would both decrease glutamate and increase NAG. NAG is a metabotropic glutamate receptor agonist. I will not go into details of glutamate receptors.
Yes.
That is another favorite area of mine. I will not go. Learning makes most men more stupid and foolish they are by nature. So when we read all these type of things and connecting things with the data, we get so much confused rather than getting more informed. And this is almost like a hallucinatory type of experience. So that is my thanks. Thank you very much.
Yes. Thank you, sir. Thank you very much.
Thank you.
There are no questions in the chat, but I have one or two
Yeah.
questions in the sense this all spiritual experiences are purely subjective, isn't it?
Yes.
It changes from individual to individual, and therefore they cannot be
Yes.
sort of objectified in that sense. So whatever we are seeing, and by the way, that was a very wonderful, exhaustive description of the underlying neurological, the mechanisms which you put up for the description of various experiences in this realm. But how do we, at certain points, it becomes difficult to differentiate between cause and effect. So how do you do that?
Yeah, I will answer it. Basically, to study spirituality is a very difficult proposition. One, because to differentiate what is spirituality and what 1 minute, if you permit me.
Yes, sir.
Hello, ഞാനൊരു മീറ്റിംഗിലാണ്. തിങ്കളാഴ്ച ഉണ്ടാവുള്ളൂ. Okay, thank you. So basically, there is an overlap between spirituality and religiosity. The maximum studies have been done only in meditations. Meditators. So some of the initial studies were done in those people who have done meditation, especially the Tibetan meditators or even trainers who have been exposed to this for 20 years or so. I mean, long-lasting meditators, and they have found this increased cortical thickness in certain areas like insula, which I already told you earlier, some of the anti-cingulate insula and
Yes.
some of the motor areas. So I told. But that is the structural way of thinking. Now, functionally also, various, especially English CBF, but PET studies, spec studies, how can you do this type of thing? Number of patients who are subjected to that, very small. I mean, 10 patients or 10 subjects or 12 subjects. How will you select it and how will you do a scale for them? Is there any spirituality index scales? But the problem is initial spirituality index in 90s, they really talk about the components of spirituality, forgiveness, compassion, empathy, all the things. But these are all Likert scales, so subjective. Likert scales are subjective, not objective.
Yes.
But there is another one is called spirituality associated wellness scale. That means after this experience, how do you feel yourself and to the others? So you feel better or you feel comfortable. You form that is basically for a maturity, a spiritual maturity subject. Another term which is used is a spiritual intelligence or SQ. What is the difference between emotional quotient and usual our IQ and the spiritual thing? They say the basic most important thing is the spiritual quotient, then only the intellectual quotient and emotional quotient. Okay. My friend who was the APA president, American Psychiatric Association president, Dilip Deshte, he is from Bombay. He's there in States since long. So we used to talk about the positive health, mental health, and he has got something called a wisdom therapy.
Okay.
Wisdom therapy. That what is the difference between wisdom and knowledge? Knowledge is proud because it thinks it knows so much, but wisdom is humble because it need not know more. And that is a rough idea. So wisdom therapy also, there are so many components which I didn't want to bring into here because that will be a little bit more, what you call, confusing. I wanted to just basically put on some of the areas which are involved, which are relevant for the neurologist. But I didn't go into details because I am a fan of functional neuroanatomy.
Yes.
So I usually talk about each area in details, half an hour to 1 hour, or small areas. For example, habanula, that is my 1 hour presentation.
Okay.
So like that, I am interested in this thing. Secondly, the history also I am interested. So as you have rightly told, it is subjective, very difficult. Can we do it here? Do you get a good sample? Very difficult. Representative sample different. And the religious feeling, the modalities are different from Chennai, Guruvayur,
Hmm.
North India, and
Yes.
our thinking is also different.
Yes.
Because, as you know pretty well, when we talk about South, do we have a Dravidian or Aryan culture? We
Hmm.
basically we do have usually a Dravidian culture, not Aryan culture. Aryan North India completely Aryan culture. That is why we say when we get somebody Alzheimer's or nothing, some genetic, there's a Germanic variant. That is German as well. Some
Okay.
people say, so that is there in the history. So we do not talk, so our religious rituals are not uniform. It is heterogeneous. The practice is heterogeneous. Subjective experiences are heterogeneous. So very difficult to say this is this. However, brain areas, many areas in the brain are involved in your well-being. But the crux is whatever meditation you do, you have got a parasympathetic overdrive and your sympathetic system were balanced. I read an article from Hyderabad. They have done some studies, the AMS, transcendental meditation, they have done with EEG. They are told
Hmm.
that there's a improvement, they get a relaxation. That is accepted. All meditators, you will get the oscillations.
Yes.
You will naturally will be relaxed because of the parasympathetic overdrive. You can understand everything. That is the only article which I have read. Very recently it has come. But I didn't find much relevance in it rather than focusing areas. So I didn't want to elaborate.
Yes.
And not done by psychiatrist or neurologist, but a physiologist. The
Okay.
initial author is a physiologist. Okay.
Okay. What now most of these studies have focused on individual areas in the brain,
Yeah.
but with the advent of these, the networks and the implication of networks like default mode network, executive network, and so many other networks in the brain, and their implication in various disease processes, including overlap of chronic pain with depression and so on. What role do they play in these kind of spiritual states?
We can
Any knowledge is.
we can extrapolate networks,
Hmm.
especially what we talk about the networks is the basics of the executive network. Number one, that you talk about it, salience network. Somebody
Silence.
talks about it.
Yes.
That is salience network is anterior cingulate plus insula. Posterior, I mean, default network is your posterior cingulate and orbitofrontal cortex. So this dysfunctions in the circuitry is well established, agreed.
Hmm.
This also can be translated to spiritual. Okay, for example, default mode network activity. If it is dysfunctional, you will have mind wandering, you can have thoughts, different thoughts. You can executive functioning will go down. So you can logically not think. That means prefrontal cortex and the parietal cortex, there will be a deafferentation. I call it deafferentation. So that means you will be in a separate state, a peculiar GABAergic posterior, superior, parietal lobe GABAergic effect. You see, that way we can establish. Networks, uh, also, I am a proponent of networks. Many places abroad also I used to talk about networks, in
Hmm.
OCD networks, schizophrenia networks. Okay, so I am aware of the networks, and some of the Indians are very much involved in Salience network. Another friend of mine from Vancouver, he usually writes on Salience network, Lakshmi Yadam, very close friend of mine. But networks and circuits, usually I speak in India. Usually I used to speak, I mean, since years together. Another area in the connectome area, how can you talk about it? That is another thing, connectomics.
Yes.
How will you talk about this thing? Uh, Very difficult to answer it. We do not have enough data. These will be speculations.
Hmm.
Okay. Well, when we talk about connectomics, or we talk about structural connectomics, functional connectomics, I mean, there are so many variants, so very difficult for us to pinpoint. We do not have the data to suggest that this is this. We cannot.
Right.
As you have rightly told, subjective experience to extrapolate objectively, it's very tough.
Yes.
Yeah.
Yes, sir. Thank you very much, sir, for
Thank
that very wonderful and exhaustive talk, which covered everything about the neurological substrate involved in many of the spiritual experiences which have been described. Thank you once again, sir, for acceding to our request and participating in the IAN webinar of the Contemplative Neurology section. Thank you very much.
Thank you very much.
Thank
Many
you,
of
sir.
your neurologists are also known to me. Yeah, I didn't see Narasimhan there. I didn't see even two same names, one from Madurai, another from Janagi, what is called, one from Madurai and one from Chennai. Yeah, it is on my tip of my tongue. I mean,
Meenakshi
yeah.
Sundaram.
Yeah, Meenakshi. Both are
Yes.
Meenakshi Sundaram, Madurai
Yes, yes,
and the
yes.
thing. Then Srinivas,
Yes.
your place at Madurai Srinivas, because
Yes.
there, I think some 10 or 15 years back, I spoke to neurologists, 15
Okay.
years back or so. Here, everyone, Kerala, my friend is Madhusudaran, very close friend of mine. We used to
Yes.
do the webinars in neurology, first class in neurology. So it's nice to really come into touch with you, and very good, because I previously, when we were students, I used to hear about Arjun Das and others. I have met him also. Jagannathan, Arjun Das, I have met them also in person.
Yes.
But later, there was a lull from my part because I was not here also. So contact with the neurologists outside was low. I mean, with my problem. Nowadays, I stopped traveling also, because otherwise, once in 3 months, I used to travel abroad, but only for
Yes.
lectures. Now,
Yes.
after the stroke, and my son also developed stroke
Okay.
1 month
Yes.
back, so he's only 38. Anyway, thank you very much for
Thank
the
you, sir.
platform. Thank you very much.
Thank you. Thank you, sir. Thank you very
Okay,
much.
okay, thank you. Good night.
Good night.